Okay, so now this is week 3 or week 2, however you want to call it, or your third lecture. We're going to be discussing chapter 8 in your med-surg book. It's going to be care of patients with cancer. Okay, so I'm going to give you a little time to, if you want to follow along in your book. Again, I've highlighted the chapters for you, so I've highlighted the important points for you, so you can follow along as well. Again, like the last time with this, these chapters are really long and they're really heavy. Cancer also is kind of like a specialty. So chances are you won't be working in a cancer unit, but that does not mean that you won't be caring for patients who have cancer, as well as being there at the beginning stages when an individual is coming back and forth to the primary care physician's office, or you're caring for a patient long-term care and you're starting to recognize and notice some of these signs and symptoms that indicate a patient may have cancer. Even at end of life, you may be taking care of some of these individuals. You could be working in a primary care physician's office. One of the roles of the nurse also is to be preventative. So, reminding our patients regarding tests that they need to have annually, at what age. I always say we don't judge or make a person feel that they are bad in some way because they smoke, or they are obese, or all these other risk factors for cancer. Our role is still just to give our patients this information, and for us as nurses to recognize signs and symptoms, encourage lab work, encourage their annual exams, things like that. Okay, so even though you realize that this chapter may be really long and heavy, you'll notice that I will basically focus on the nurse's role, focus on some patient education. You're free to, you should, I won't say you're free to, but you are free to, but you also should kind of go back and read this information in detail. Anything that you don't understand, remember to email me. We can kind of also discuss in class. The other thing is kind of research some of the information. If it's something that you seem interested in or something that you're really not familiar with, like, I don't know about this. So kind of research it. I've tried to put like little notes on the outside of my book, some of the highlighted portions, so to kind of go a little more in detail for you, or maybe enhance your understanding of it. All right, so scrolling down again, you know how this electronic med-surg book is, so it can kind of give us the blues. All right, so we're going to begin now with the impact of cancer. So basically just understanding what cancer is. Cancer is just uncontrolled abnormal cell growth that can either stay in a particular area, or it can metastasize or spread to other parts of your body. Age can be a risk factor. Chronic diseases, so chronic diseases meaning your diabetes, things like that, can increase your risk for cancer. So let's see. The book also talks about 68% of patients living 5 years or longer, especially after they've gotten cancer, just because of the changes, the research that we've had in cancer, the advancement in treatment increases an individual's risk for surviving that. And of course, I have to say, even with the education, the nurses educating our patients so they are more aware of what's going on with their body and ways they can prevent and treat different things. All right, let's see. Prostate, breast cancer, lung cancer, colon cancer are some of the main cancers that you always hear about. And they are the leading causes of new cancer as well as cancer death. So what does that mean for the nurse? Then our role then is prevention. We are aware of these things, and then we're going to learn later in the chapter about signs and symptoms that an individual has issues with these certain types of cancers, how we can educate our patients on preventative measures. Sometimes preventative measures really rely on recognizing these signs and symptoms early on, and then getting the treatment that extends the individual's life. Okay, so you also kind of see a figure there that tells you selected sites of new cancer and cancer cases. So you can kind of look at that, and kind of gives you some of the main cancers. This is not an exhaustive list, but it kind of gives some of the main cancers that you may see in practice. Okay, the current incidences of cancer, they're about 20% higher in men. And we talked about this the last time, how a lot of times men are not as apt to go to the doctor like women are. So we always say women, their partners, family members. I always feel like then it's our responsibility to have these conversations with our male counterparts and discuss, like signs and symptoms, educating them on, hey, make sure you get your test. Sometimes it's as simple as, how have you been doing? Or I've noticed you've been losing weight. What are you doing to lose weight? Because that question simply allows you to know, is the individual trying to lose weight, or did the weight just fall off? And sometimes some people are like, oh yeah, I'm liking the weight, I haven't been doing anything, haven't taken anything. Or they may be like, oh yeah, I walk just a little more. And so you as a nurse or a medical professional may understand that, okay, let's see, this may not be normal. When was the last time you've seen the doctor? All right. So another thing is the cancer incidence, or occurrence. So incidence is occurrence, and so I'm just kind of trying to teach you all some of these terminologies. So when you see them again, you're aware of what they mean. So the cancer incidence or occurrences are higher among Black men and white women. So I thought that was kind of an interesting fact, just so you're kind of aware of that. That does not mean that you exclude everyone else, but just so you are aware that these two groups of individuals are at increased risk for that. I also want you to kind of understand too that sometimes it's not known why. Like, why Black men and white women? Why not Black men and Black women? Or why not white men, white women? You will kind of learn that sometimes cancer is not, even though we've made a lot of advances in testing and research of understanding what puts an individual at risk for it, some things are still just unknown related to that. Lung cancer remains one of the leading causes of mortality meaning death among men. So again, you think about, what is our role in that? What does that mean to a nurse? So when I think of that, because it even talks about among women, lung cancer, breast cancer, colorectal cancer are the leading causes of death. So, okay, maybe we're not working in the cancer center, but we do see these individuals before they get to the cancer center. So our role then as the nurse is think about, what are the signs and symptoms? What would indicate that an individual may be at the beginning stages? We also have to kind of keep in mind some individuals may have no signs and symptoms at all, and they may not exhibit signs and symptoms until the latter stages. However, sometimes when we go back and we think about it, it's like, oh, wow, you did kind of see these things at the beginning. And everyone that has these signs and symptoms does not necessarily have cancer. But think about shortness of breath, especially with someone, having lung cancer. And the key to these things are their changes. It's just changes. Like I usually didn't have problems, walking from my house to my car. I mean, it's the same distance. There's no change in that. Yes, I know I'm getting older, but before I did not have shortness of breath. You think about coughing, like, why are you coughing? And initially, sometimes we start making up excuses, oh, it's allergies, or, oh, that must have been somebody's perfume or something like that. But it's just this cough that's just consistent at odd stages. Sometimes these coughs, you can see blood in the cough, or in the sputum of the cough. And sometimes people think, oh, it's just because I continue to cough and I'm irritating my throat. Those still are all signs and symptoms that we don't diagnose. We send you to the primary care physician or for the physician to diagnose. Even as far as breast cancer, so any changes in the breast, any changes in color, any lumps, any swelling, any pain, any discharge from the nipple, all those things like that would kind of be an indicator that there's possibly something going on there. Again, it needs further investigation. And then when we look at colorectal cancer, so again, change. So I want y'all to kind of keep in mind it's the change. So it's change in bowel habits. So you went from having a normal bowel movement, and it doesn't matter if it was Monday, Wednesday, and Friday. That's when you normally had your bowel movement. Normal consistency, you didn't have any issue, and then all of a sudden it goes to you're having a bowel movement every day, and this is how it starts. And then you notice that the bowel, the stool doesn't have any consistency to it, so maybe or bulk to it. So maybe it's kind of really soft, or it's loose. Maybe you notice a little mucus in it. Maybe you notice a little blood. Maybe now you start noticing your stomach starting to cramp a little more or hurt a little more. Maybe you notice your appetite decreases. Maybe you've noticed a little weight loss, things like that. Again, it's the change. It's also left up to the nurse to ask those questions. If we, again, notice someone that's losing weight, hey, what are you doing? When was the last time you had a bowel movement? And a lot of times you all have noticed, too, that sometimes the patient really can't tell you, what my stool looks like. But when you ask them that initial time and when you say, hey, start looking at it, we're all of that age to where being aware of what's normal for us is vital to our health. That's education that you're giving your patients. So again, talking to your patients about that, asking them, being specific, you notice any blood in your stool or when you wipe, have you noticed any mucus in it? It feels kind of slimy, and it's your professionalism that makes the person feel comfortable with that. How often are you having a bowel movement? Monday, Wednesday, Friday. Is that normal for you? Were you used to going every day? And these are quick questions that you can be asking while you're entering things into the computer, while you're gathering material for their vital signs, things like that. But it is important questions that we need to ask. All right, so pathophysiology of cancer. You don't have to worry about this. This is something you can read on your own. The video, you watch the video, kind of goes a little more in detail with that. But just for this lecture, I kind of really want to focus on the nurse's role and what we need to know. Kind of also want to kind of give you some terminology again. Okay, so cancer cells do not behave like normal cells. So cancer cells, again, they overgrow. And so these cancer cells, when they begin to overgrow, are not following the normal pattern of the DNA of our cells. And that's just our genetic makeup. Okay, these two helix, they kind of go, and it tells us how our body, our chemical makeup, basically, with that. So when you have these cancer cells, they invade this DNA makeup, okay? And when it starts invading it, it starts changing the pattern. And so when it starts changing the pattern, that's where we see all this abnormal tissue growth, these malignant cells. They start multiplying. They just don't appear to know when to stop, okay? And so that's where you generally a lot of times will start seeing tumors or abnormal growths. And that can be like flesh color, like on top of the skin, lumps, nodules. These tumors can be debilitating to an individual, so they can grow so big on the side of your jaw that they can't really chew. Or they can grow so large in your esophagus that it's difficult for you to swallow. Or they can grow so large in your lungs that it's difficult for your lungs to expand, difficult for you to breathe. Same thing if you have a brain tumor, this overgrowth of one cell that continues to grow, that presses against nerves, decreases blood supply. So there's a lot of things that can happen when you have this abnormal cellular growth, okay? The other main thing with these tumors or cellular growth is that it can metastasize. And we'll look at table 8.1, but metastasis basically means it can go through the bloodstream and go from one spot. So it originally started in the breast, and now it has metastasized or moved to the cancer, moved to the bone, or has moved to the lungs, liver, brain. Just a variety of parts. So certain types of cancer generally kind of metastasize to certain sites. The one thing about this is these individuals, you may say, okay, they have bone cancer, now. But know that where they initially had the cancer diagnosis, so it was initially breast cancer, it will be known as breast cancer that metastasized to the bone. So yes, you do have bone cancer, but your diagnosis is still breast cancer. Yeah, because I hope that's not really confusing to you. But understand it's the original site is the type of cancer you have, and then it says metastasized to that. Okay. Let's see. I'm not going to go all through table 8.1, just something for you to kind of be aware of, just kind of where these certain types of cancer can metastasize to, knowing that when an individual has this, when you're starting to feel like this individual has, or cancer has metastasized, sometimes you may start seeing shortness of breath. Sometimes you may see, especially with the brain, aggression, depression, loss of memory. So you think about those things. So it's going to be looking at the change. You can kind of start seeing sometimes changes related to that. Okay, so again, metastasis just refers to the movement of the malignant cells, and they just kind of transplant from one organ to another. And so you know how people normally say, I'm not going to get surgery when I have cancer, because they told me, if you get surgery while you have cancer, it's just going to spread and you're going to die faster and things like that. So know that these individuals there is some legitimacy to that. It's basically some individual, what the thought is or the belief is during surgery, the gloves can contaminate, or the gloves or the instruments can contaminate other parts of the body with malignant cells, and thus you can have it, or it can kind of break away from a diseased organ and go into another organ. So just wanted you to kind of be aware there is some validity to that. That's what I was looking for initially. There's some validity related to that. So when people say that and they have a fear related to that, you can understand that it's just not them being like, what? No, that doesn't happen. Yes, and this is why it happens. But know that when they're in surgery, they do take great strides in trying to prevent this as much as they can. But again, when you have cancer, think about your immune system still has weakened because you have this overgrowth of cells, and everything is going to try to fight this attack on your body. So it does weaken your immune system, along with the treatments that you're doing, the decrease in appetite that you have, and all the other issues that kind of go along with having cancer. It just kind of predisposes you to a lot of things with that. Another key word that I think you need to be aware of, so besides metastasis, so that is going to be the movement of these malignant cells to another part of the body, okay? Either through surgery or through it just breaking off and going through the bloodstream on its own with that. But prognosis is the prediction of survival. My prognosis is 2 years, 5 years, things like that. And that really just depends on the type of cancer you have. It depends on the treatment that's available to you. And it depends on any pre-existing conditions that you have, like what was the state of your body before you got this cancer. Okay, so a lot of things kind of go into or factor into this. The book doesn't really mention this at this point, but I kind of want to also put on it when they talk about prognosis. I don't know if I've told y'all this before, but there was a study that was done related to individuals getting a diagnosis of cancer. And they talk about, sometime as soon as an individual hears that they have cancer, then they automatically think, oh my God, I'm going to die. And those individuals, even though it may be a cancer that's easily treated, say like a certain type of skin cancer, so it's kind of easily treated, but because they hear the word cancer, or even prostate cancer has been known to kind of be easier to treat. But as soon as they hear this cancer diagnosis, they immediately start to stress out about it. And even though it's an easily treated form of cancer, their prognosis may not be good. They may actually die in an instance where someone has been told that they have cancer, and it could be a form of cancer that's a little more difficult to treat. And say maybe it's breast cancer or it's, lung cancer. But these individuals, when they hear that, they're starting to do the things that they need to do. They're starting to change their diet. They're ensuring that they take their medication. They're increasing their mobility as much as they can. They're surrounding themselves by family and friends to help them along the way. They have financial support. They have transportation. So all these things are kind of set up for them, which decreases the stress load. And so for those individuals, even though the prognosis may not be good, even though they may say, okay, prognosis for this cancer is about 1 to 2 years, these individuals may live 6-7 years or actually go into remission. And they said it has to do with the optimism or your brain, how you perceive this diagnosis, and decreasing the stress response in your body. It can be mean saying like, hey, okay, I'm hibernating. I'm going to stay away from individuals because I don't want to get sick with things such as the common cold that would increase my risk of dying related to a complication. Okay, so I just wanted to kind of throw that in there. Another term that you may see, especially on the diagnosis, if you're taking care of an individual in long-term care, or diagnosis that comes back in the primary care office, is in situ. So this just means it remains in that original spot. So if you got breast cancer, it just remains there. Okay. If you got lung cancer, it just remains there. It does not metastasize or travel to a different area. Okay. So just kind of being aware of that. Let's see. Well, you see the definition of regional cancer and advanced cancer. So just kind of being aware that advanced cancer is often fatal. Okay, so this is just kind of when it's gotten to where the treatment may cause more harm than good, may make the individual sicker, weaker, along with, say you initially had brain cancer, you initially had breast cancer, and that breast cancer went to the bone, and then it also went to the brain, and there's just a lot going on. Or when you realize that you have cancer, and we'll talk about staging, and I'm just looking at one of the books that I have, and say, when they do find out. So maybe this individual recognized that there's a lump there. Maybe they've had some nipple discharge, and maybe there was a change in the color of their skin or some dimpling of their skin, so indicating some breast cancer. Maybe they realized that, but they just did not want to face the facts. They didn't want to go. Maybe they had something else to do. Everybody has their own reasons related to that. So by the time they do decide to, I'm going to go to the doctor because maybe I'm starting to feel tired. Maybe I am starting to lose a lot of weight. My appetite is not as good. So these things. And so by the time they get to the physician, they have a stage 4 breast cancer. And so a radical mastectomy is not just going to do the job, because they have the cancer is kind of metastasized or spread, versus if they would have went at the initial sign and they had a stage 1, it may be that maybe we just going to do a lumpectomy. So we remove that diseased part when we were talking about in situ. So it could be the growth is there at the spot and just maybe some of the surrounding tissues, but it hadn't metastasized to anywhere else. Okay. So just knowing that that's why we're really big on prevention, education, recognizing signs and symptoms early on, so we can get the diagnosis when they're at stage 0 or stage 1. And stage 0 is carcinoma in situ. So it's just the abnormal cell growth in this area. Okay. And we'll go a little more detail into that a little later. But you just want to do your best to try to stay away from advanced cancer cells. However, I have heard of individuals that have actually gotten the diagnosis of, say, like breast cancer. I'm just using them just because that's the one you hear a lot. Breast cancer, prostate cancer, lung cancer. They've gotten them, and 3 months later they've passed away. And you're like, wait a minute, I saw these individuals. They were up, walking around, laughing, talking, or whatever like that. The cancer is so aggressive. So the overgrowth of the tissue of the cells are just so advanced that even within those 3 months, there's so much damage related to that. Okay, not all malignant cells metastasize, but most do. So just kind of being aware of that. Let's see, and just know that abnormal tissue growth does really affect that organ. Abnormal tissue growth in the lungs affects your breathing. Okay, and then you think of everything that goes along with that: fatigue and inability to be able to exchange CO2. Having to wear oxygen a lot, so it's just a lot. Decreased mental capacity, a thought process. Okay, we're on the genetic factors. So all cancers result from a defect in the DNA gene. So we've already kind of talked about that. It could be either inherited or a mutation. Let's see, and it's just that it was change related to either something you've come in contact with, so certain types of chemicals, certain types of medication, certain types of medical diagnoses, things like that. So it's just a variety of things that can cause that. Two other terminologies that I did not highlight, but just so you're aware, if you see these terms again, is the oncogene. It's just a normal gene that involves in cell growth and reproduction that can become mutated and produce cancerous cells. Okay, then you have a tumor suppressing gene, which is just a normal cell that actually kind of goes in and tries to repair these abnormal cell growths. Okay, so this is basically what a tumor suppressing, just kind of what it says. It just goes in to try to repair this, say, oncogene, an oncogene, the oncology, cancer. So think about that as just a normal gene that just begins to overgrow. Okay, so when we talk also about carcinogenics. Okay, these are things that damage your normal cell growth, and it's just kind of difficult to repair them. So some of those are related to harmful agents such as chemicals, radiation, viruses, and other infections. And it kind of presents with an immune response. So certain hormones, inherited genes can cause this, certain medical conditions with that. And so when we talk about as well as viruses and things like that, when we look at the Epstein-Barr virus, and so we talked about that previously. So having issues like that, you think about hepatitis B, let's see, H. pylori, tanning salons. Are you actually tanning certain drugs, tobacco, formaldehyde, and formaldehyde is found in smoke and exhaust. So you hear that. Radon, which is a natural gas, it's odorous, it's tasteless, so it's nothing that would give you an indication that this gas, but it's a natural substance that's formed by the breakdown of rocks, and it's just natural in the environment. So all those things can increase the risk of cancer. So we kind of have to be aware of that. When we also think about chronic or medical conditions, certain medical conditions, you think about chronic inflammation, autoimmune diseases, hormonal imbalances. All those things can also increase your risk for that. That's your diabetes, your hypertension, all those type things, ulcerative colitis. So when you think about that, rheumatoid arthritis, when you think of this constant inflammation, but generally, just think about that. It's kind of really the main thing. Table 8.2 will give you some common carcinogenic substances, so you can kind of review those. Kind of be aware of some of the basic ones. So again, like tobacco, you always kind of see that. Asbestos, you always see the commercials related to that. Benzene is another really big one that you'll see, and it's kind of, you getting that from gas, the gas that we put in our vehicles, and then alcohol. So some of these first 4 or 5 are really your bigger ones, so just so you're aware of that. One that we don't talk about a lot is the estrogen. So, and we'll talk about it a little later, but those also increase the risk. But it tells you again, HPV. And the main thing with these, and we'll talk about a little later, is the treatment, recognizing and treating these things. Older adults are at increased risk for developing cancer, as well as your immune compromised individuals are at increased risk. So those is just really the biggest single factor. The book kind of talks about that. So again, so at a certain age, you're 45, 50, 60, 65-year-olds, we really kind of stress the importance of your preventative exams, your prostate exams, your mammograms, just simply getting your physicals, getting lab work done. Because some of these things, if you get them annually, when there's a change, it's easier for the physician to kind of recognize that. And a lot of times the nurses are the ones that can see, like, decrease in white blood cells. PSA is starting to elevate. The physician should see that, but these are some things that we can see as well to help with that. Repeated exposure to these chemicals that we kind of talked about, the radon, the benzene, all those things like that, is what increases your risk. So those are those natural things, but the other thing is that repeated exposure to things like cancer. Cigarettes. Lord, I can't get my words together. But repeated exposure to like the cigarette smoking, whether it's you actually smoking, or you're around someone that also smokes. So the book tells you about increased risk of lung. Has been linked to esophageal, pancreatic, bladder, kidney, liver, colon cancer, all those things. But what does that mean again for the nurse? So I kind of told y'all that we're going to be really basing on what does that really mean for the nurse? What do I need to know with this? Because we know that tobacco has been linked to a lot of other types of disease, and when it's tobacco linked with diabetes, then you see this increased risk. Or a lot of individuals that have colon cancer also kind of smoke, or they have liver cancer, they also kind of smoke. So you kind of seeing these things. Chewing tobacco, your tongue, mouth. These are sometimes the individuals that you see when they've had to have part of their tongue taken out or part of their jaw taken out just because these abnormal cell growth in this area, and they basically kind of go in and remove it. And so what does it look like? Sometimes it's color discoloration of the tongue, or discoloration of the jaw or on the gums. Sometimes it may be like a furry growth on it, yeast that kind of continues to grow on it, a color change in the skin, whether it's on the tongue or the side of the jaw. Those things are generally your indicators that something's wrong. Thus the importance of when you're going in to do an assessment, open your mouth, let me look inside. So even when you go and you take someone's temperature, sometimes those are the things that you can see, that you notice, like, how long have you had this? Let's kind of keep monitoring it. Has there been a change in it? Or if anybody talks about having like little sores or ulcers, canker sores, a lot of times what people say, those things can indicate that something cancerous going on. So again, us as a nurse, then we want to educate our individuals or our patients on this. So we want to look at smoking cessation. We want to talk about medications that's really good for that, Chantix, bupropion. But also with that, we want to talk about some side effects of that. So when we give these medications, as a nurse, we kind of have to be aware of that. A lot of times it's sleep disturbances, a lot of GI upset kind of related to that. Sometimes you also will see mood changes. But then, so we're talking about, we've told you, you need to not smoke. We've given you, talking about medications that's used to help with that, Chantix, bupropion. And we're also looking at your side effects, so we're monitoring for that. But then you also have to know or remember that smoking cessation is kind of really hard to do, especially for someone that has smoked for years and years. And a lot of times these individuals have smoked for years and years. So we talk about distractions, so finding other things to do, finding other hobbies that kind of keeps your mind off of it, because it's said that what increases the relapse is they start thinking about, I used to do this, I used to go on these long road trips, but I smoked then. Or, when I went to clean out the backyard, I would smoke, too, or whatever. So it's kind of finding other distractors to help you not think of that. Your social group, so not hanging around individuals that still smoke, because that increases the risk of you relapsing. Staying active, so activity, exercising, those things are better as well. And kind of before I leave that too, we think about the individuals that are at risk for chemicals. So those that are at risk for asbestos, radon, or chemical waste. So you think about your industry and your factory workers. You think about how they dispose of the chemicals that they've used and how it goes into the ground and seeps into the soil, how it also seeps into the water, things like that. So you think about those factory workers and increasing their risk. And a lot of times you see those individuals have a high incidence of cancer. Not only just those individuals to stay in that area, but it's those that stay around that area. That's also why they have rules and regulations on how you dump or dispose of certain chemicals. But still, those gases or fumes that are emitted still puts individuals at increased risk. So just kind of being aware of that. And so when you ask people where they stay, especially if you're from the area, you stay over by the paper mill. We used to have that in Lufkin. You stay over there by Tyson, or you stay over there by Pilgrim Pride. In that area. And that's just something that we always kind of keep in the back of our heads. So if things start changing for this individual, we kind of can go to let's make sure this individual doesn't have cancer. So that kind of goes along with the surveillance. of that, noticing any types of changes with that, knowing that individuals that have immune compromise, so they've had an organ transplant, because their immune system, remember we've already talked about how the immune system kind of recognizes an antigen or something that's abnormal, and they go and they fight for that. But if the immune system is unable to recognize this abnormal cell growth or this invader, then it continues to have this overgrowth, and it's a little difficult for them to respond and fight that. We'll talk about hormones. So the really hormone therapy or hormone replacement therapy increases the risk of cancer. Those type medications are like your estrogen patches, your oestrogene, there's gels, sprays, your vaginal oestrogene, Mirena coils. Sometimes they're used in combination with estrogen, testosterone, which also is kind of a combination of testosterone with progesterone and stuff like that, to kind of help with hormone replacement. So the signs and symptoms the individual has. So the key thing to remember with that is it's only recommended to utilize this treatment for 2 to 5 years, simply because it increases the risk for cancer. It's these hormonal changes or growths with that. An individual is when you have an individual that kind of complains of having night sweats, hot flashes, things like that, these individuals may be in menopause. So it's going to be, like, hey, are you taking anything for that? But also kind of being aware that these individuals may be at increased risk for cancer or breast cancer, okay? And so that's education. Like, hey, okay, so you're taking this, so we're going to be preventative, and that's how we're going to do it. Like, you need this because you need your quality of life to be improved. So let's do some breast cancer. Assess for breast cancer once a month. And we're talking about doing that once a month at the same time at the beginning of the month, around your cycle, but it's just kind of really at that same time while you're in the shower or things like that, so you can, and it's the consistency of it that will help you notify or alert you if something's changed. Let's see. So we've already kind of talked about the effects of smoking. 90% of lung cancer in men and 79% in women are related to smoking. Okay, so just kind of doing that. Know that adding alcohol into it, so not only do you smoke, but you also add alcohol, increases your risk for that. Let's see. So cancer promotion, again, is just basically adding the alcohol. Adding something into it or something combined with a carcinogenic increases your risk for cancer. Radiation, so that's why you normally put on the coveralls. I'm trying to think of the name of those coverings to kind of protect you, because the more exposure you have to radiation, it can do some chemical changes and increase your risk for cancer. Ultraviolet rays, so the sunlight, so that increases your risk for leukemia. With that, ultraviolet rays increase your risk for skin cancer, bone marrow, breast and lung and thyroid cancers are increased related to that. So we know these ultraviolet rays, we know this radiation, so especially with ultraviolet rays. So then we're going to be looking at, all right, so how are we going to prevent it? Because then again, we keep talking about then the nurse's role. What is the nurse's role in this? I'm giving you this information, but what does it mean? Why is it important to me? So then our role is then to educate. Let's educate our patients related to that. So when we're educating them related to that, we're thinking about sun exposure. So wearing shades when you're out and about, and they need to be the shades to kind of wrap around to continually protect your eyes. Wearing long sleeve clothing or thin long sleeve clothing to protect your skin. The other thing is wearing wide brim hats that can also protect you. The CDC said sunscreen of SPF 15 or higher. The book talks about SPF of 30 to 45. So that. And the other thing is to stay inside. During daylight savings time, it's 10 to 4. When standard time, it's 9 to 3. So just know within those time frames, ultraviolet rays are at its highest. So just kind of making sure that if you're out during these times that you're taking these precautions. And that's education that we give our patients during the summertime. as well. That's something that you do. As well. Getting a more serious sunburn before the age of 18 can increase your risk of skin cancer. So just kind of being aware of that. Malignant melanoma runs into families, so that's why we ask, have you had anybody that has had cancer? As specific as they can related to that. We've already kind of talked about different viruses, bacteria, parasites, all can increase your risk. Epstein-Barr virus, herpes virus, HIV, all those things, because it decreases your body's ability to be able to fight or recognize. And when it's unable to fight, or you're immune compromised and unable to recognize these type symptoms, it increases your risk of cancer, because what happens is these abnormal cell growths can continue to overgrow, and you don't have the ability to be able to go through and fight them, or before they're able to realize that you have it, it's so far gone that it's a little harder on you, okay, or it transfers at a faster rate. Let's see, corpuscular sarcoma, you only see it in HIV. It looks like you only see it in HIV, but if I'm not mistaken, you also can see it in TB as well. It's a skin disorder, and it's thick, dark spots that kind of grow on your skin. It looks like eczema, but it's like patches that you can have on that, and you'll know it kind of when you see that. And we'll pull up a picture of it. You can kind of Google and look actually what corpuscular sarcoma looks like when you can see it on someone's skin, because I know one patient that they kind of mistaken their corpuscular sarcoma for eczema, and when you looked at it, it was just black raised area that was on the skin, and they complained of itchy skin kind of with that. Let's see, early and complete treatment. So we're kind of at the end of that paragraph. Early and complete treatment for infections can decrease inflammation and prevent some cancers caused by infectious agents. So again, I wrote educating on vaccinations. That's it. We're going to educate you on your HPV vaccinations, your hepatitis vaccinations. We're going to recognize signs and symptoms of H. pylori. So we're going to, if a patient comes in, they're complaining of some stomach discomfort. So some stomach pain, some nausea, some bloating, indigestion, a lot of burping. And again, it's this change. Like, I'm having this, maybe if I've had it for a little bit, maybe they've noticed some weight loss, some change in some appetite. So just being able to recognize these things, and then we know that those individuals getting the stool sample, and explain to them the importance of getting that, or us requesting that. And then treatment related to H. pylori, there is generally treated with two forms of antibiotics at the same time, and a PPI, which is pantoprazole, and then an H2 Tagamet, so some variation of a PPI and an H2. They may also give you something to kind of help coat your stomach related to some of the ulcers that you have in it. Genetic predisposition, so just know that some individuals are more at risk just because of it's just inherited gene. Some individuals will just have that. The BRCA1 and BRCA2, one of the most common ones that you've heard of a lot, related to women with breast cancer, but they also kind of do some family history. Do you have a family history of this? Have you had a personal history related to cancer? Know that these genes do not directly cause cancer, but it's just they put them at a higher risk. And that's where you see some individuals say, nope, you know what, I want to go ahead and get my breast removed now because I don't want to go through this. I don't want to have to live with, every time I get my mammogram, will it come back positive for it? And so they're just like, you know what, they're just boobs. And they do the radical mastectomy. Okay? So just kind of being aware of that. All right. And again, know your lab test, and we'll talk about it a little more later. Does not say that you have cancer. It just kind of helps identify, and it doesn't confirm cancer. It kind of helps identify and helps identifying with relapse. Cancers come back. All right, certain intrinsic factors. So, what are your contributing factors to cancer? Age, again, older, sex, so African American men, Caucasian women, race, again, so certain individuals are at risk for certain types of cancer: African American, Hispanic, Caucasian, all types. There, 76% of all cancers are between the ages, are people ages 55 years and older. So kind of know that that's just kind of a marker when you kind of really start focusing on that. We start talking about prevention, eating healthy, exercising, staying away from certain foods, and things like that that can decrease your chance, especially when you have a family history of it. At 55, we really start kind of honing in on prevention and being aware. So, let's do the test. Let's do the test because we want to ensure that we're able to diagnose cancer at an earlier stage. Okay. Let's see. We talk about acid reflux. So when we talk about, being able, the signs and symptoms that indicate an individual is at risk. So there's acid reflux. So then we talk about treatment. So we have someone that's constantly coming in talking about acid reflux or taking medication for it. And we've talked about in GI, how that constant taking medication to decrease the acid or neutralize the acid, how it can have its own effects on you as well. So we need to talk about, changing your diet, changing your food, also smoking, alcohol, eating late at night. These are all education that we give these individuals that have it because we know that acid reflux increases the risk for cancer. Prostate is more common in black men than in white males. Breast cancer is more common or prevalent in white women than in Asian women. Okay. So it kind of gives you a little bit of that. Dietary factors, so obesity. So we talk about that anybody 30% and over on your BMI. Let's see, and it's one of the strongest predictors of cancer. So again, what is the nurse's role? We're educating. We're talking about the ultra-processed foods. We're talking about drinking a lot of alcohol. We're talking about increasing lean protein. I'm getting the book, and let's see. Yeah. So it talks about eating 5 servings of fruits and vegetables a day, eating your lean meats, fish, skinned poultry, low-fat dairy, whole grains and beans. Avoid salt-cured, smoked, nitrate-cured foods. And, we also learned, too, you drink orange juice and it kind of helps decrease some of the nitrates related to that. But, again, the best thing is just kind of avoiding it. But when you have someone that's not going to avoid it, add the orange juice in it. And then limit saturated fats and added sugars related to that. So I want y'all to kind of make sure you kind of keep those things in mind when we're looking at patient education. And we're not just going to say, you need to change your diet or you need to eat more healthy. Let's give them the examples, what they need to do, eat these lean meats. If you're going to eat barbecue, drink some orange juice with it, especially if you're at high risk. And those that are at high risk, we really want to push for just don't do it at all. Okay, so making sure you kind of keep those in mind. 5 servings of fruits and vegetables, just when we're doing our patient education. With that, let's see. It says a diet high in fat has been linked to the risk of cancer recurrence. So preventing someone that's already had cancer and you're trying to prevent them from a relapse in that. So we are still on that. And it's what is the Cancer Center of America, I think it's up in Tennessee or somewhere, where their whole thing is on diet. They go through and they change your diet to decrease your risk of cancer. All right, let's see. Common cancer promoting factors: obesity, insulin resistant, and inflammation in patients with type 2 diabetes. So again, it's this whole, diabetes is an inflammatory response, and we talked about that earlier. Obesity, the stress and strain that you put on your body, related to that. Classifications of tumors and tumor stagings. Let's see what I want to tell you. out of that, you can kind of read that. It's just kind of some basic stuff, just some terminology for you to be able to be aware of. Like leukemia. Leukemia is the cancer of the blood. Malignancies of the pigment of the cells are called melanomas, so it kind of gives you that. A carcinoma originates in the epithelial cells, so the lining of organs and skins, and the sarcoma arises from the mesenchymal tissue, so your bones, your muscles, and other connecting tissues. Cancer staging. Oh, hold on just a second. So when we're looking at cancer staging, so the main thing is I kind of wanted to like see what specifically NCLEX wants you to kind of know related to that, because some of this stuff, like I said, is a lot that you're not going to have to do. And so basically they're just saying knowing the difference with grading and staging cancer. So we just talk about staging. Stage 0 is carcinoma in situ. So remember, it's just there at that localized spot. So it's just in the breast. It has not metastasized anywhere else. Stage 1, tumor limited to the tissue of the organ, localized tumor growth. And then stage 2, limited to local spread. So it's just maybe around the muscle area. And then you got stage 3, extensive local and regional spread. So it's just getting larger in that area, but it has not necessarily metastasized to another organ. And then you have stage 4, is distant metastasis. So like you had it in the breast, and now it's in the brain, or it's in your bones, or things like that. So it's kind of what they want you to know with that. And so main thing is you just knowing 0 is just that abnormal cell growth. That's what they know. Okay, so that's in situ. There's abnormal cell growth, and then as you move up, as you progress, when you stage 4, is it's metastasized. Okay, so basic thing that you want to know about that. All right, so that's all we're gonna do in that area. So now measures to prevent cancer. I'm going to read exactly what the book says, because I think this just kind of says it all. Each patient encounter is a time for you to use to teach patients the following cancer prevention measures. And we're just you kind of be able to read through this and go into detail, but nutrition and exercise for cancer prevention. So maintaining a normal weight. So we already talked about obesity. Obesity is said to be anything, your BMI of 30% or over. With that, encouraging healthy diet. So we talk about limiting the process of red meats. So that's hot dog, bacon, sausages, lunch meats, chicken nuggets, candy, dessert. When we're educating our patients, verbalize those things. Just don't say healthy diet, but verbalize. Avoid drinking excessive amounts of alcohol. So remember, it says excessive. So maybe 6 ounce of wine, is okay every now and then. Limit salted, grilled, and smoked food, so your barbecued food. And when you do, add some orange juice to it. Encourage exercise, so that's 150 minutes of moderate intensity exercise a week, okay? So remember that children need to get an hour of exercise 3 days a week, or each day. Limit that sedentary lifestyle. Not sitting down watching TV, so thinking of some other things that you can do with that. The gray box where it says nutritional consideration, you kind of read that again in detail. So minimizing the risk of cancer. So it talks about eating brightly colored fruits and vegetables. Okay, so thinking of that, what does that mean to you? Eating your salads, watching your processed meats. They want you to eat fatty fish twice a week. That increases your omega-3 fatty acids. Let's see, limiting the intake of saturated fat. So it's the oils that you cook your things in. Let's see, eat 5 to more servings of vegetable a day. Choose whole grain foods over processed grain. So that's including beans, whole grain cereal, whole grain breads, and pastas, being the fiber pastas with fiber in it. Let's see. Knowing your environment, so understanding individuals that work around fertilizers or pesticides. So think about what individuals are employed in those areas. And then think and industrial waste. So being aware of that and knowing that these individuals are at increased risk, so we need to ensure that they come in for their annual exam. Make sure they get lab tests done. We need to be more detailed when they come into the office just for a routine medication refill. We understand that these individuals work there. How's your weight? How's your sleep? What types of food do you eat? Kind of okay. Be careful with that. Noticing a little weight gain. We want to keep you healthy, and so sometimes it's all about the presentation. In that, keeping up with your local water supply. Is it appropriate for your patients? Let's see, avoid and limiting exposure to carcinogens. So you can just kind of read up on this, but just being aware of all the things that are out there, the importance of washing your hands, the importance of using protective gloves when you're going to be outside working with chemicals, protecting your skin when you're going to be working with chemicals, protecting your airways, so wearing a face mask, things like that. Again, like I said, and washing your hands, doing your sunscreen is another important thing to talk about. Let's see, avoid swimming and playing in water that's contaminated. So keeping that in mind. Avoid eating fish in water that has been contaminated. Okay, so anything that kind of goes in. Make sure you wash or rinse fruits and vegetables before eating or cooking to decrease the exposure to agricultural pesticides. Because again, those things are chemicals that goes into our body that can cause that increase in that oncogenes, so that abnormal cell growth. So these are just some preventative things, and I think those are the things that are more important that you need to be aware of so you can educate and teach your patient. Know the signs and symptoms. So think about if someone has come in contact with pesticides, think about how it may change the skin. Think about constant irritation of their lungs, that coughing, maybe because of some some blood-tinged sputum. Maybe think about some shortness of breath, things like that. Irritation in their nares if they're breathing certain things. That skin irritation increases their risk for skin cancer because of, again, also remember to our infection because that's the first line of defense for us. So then the other thing is we're going to look at detection of cancer, so the purpose and screening for cancer. So warning signs. Another thing, I want you to kind of make sure you focus on that. Unusual bleeding or discharge, a sore that does not heal, a change in bowel or bladder habits, a lump in the breast or other part of the body, a nagging, persistent cough, an obvious change in a mole. So it started out being a little dot, and then all of a sudden they just notice, like, golly, this is getting bigger. And sometimes it's kind of hard to tell. Go get it assessed. Go let somebody measure it. There's simple tests that they can do to discover that. It's not one of those, okay, it looks the same size. No, let's go get it tested. Okay? Difficulty swallowing. Just being aware when a patient says these type things. This also kind of gives you some verbiage to be able to use when you're talking to your patients. Have you noticed any difficulty with swallowing? Have you noticed any changes in your mole sizes? Do you have a sore on you that how long has that sore been there? So it's those little simple things that we want you to learn to be able to critically think when we're talking about this, understanding the importance of recognizing these things that are just as simple. What does it look like in practice? All right, let's see, we've already talked about cancer in the age of 40 to 50. So the book initially said 50, but just kind of start knowing that 40 to 50 range with that. It's important for women to get their pap smears to detect cervical cancer. You go in once a year for that. After you started having sexual intercourse is generally the rule of thumb with that. Your fecal O-cup blood, basically what they're looking to see if there's any O-cup blood or hidden blood in the stool. So that means a lot because sometimes it's difficult to tell whether it's related to hemorrhoids or actually is it internal. The color, bright red versus actually darker blood. O-cup blood, like I said again, is not always an indicator of cancer, so just kind of being aware of that. Basically what you do is you have an individual to get a piece of their poop or their stool, and there's a little card that they have, and they kind of rub it on the card, just a little bit of this, a little stick, maybe about this big or whatever, and you take a bit of the stool, and they'll have you to put your stool in a hat. You take a little bit of that, and sometimes they say from the end, from both ends and in the middle of it, but you take a piece of it You rub it on that card, you seal it up, you take it back to the physician's office. They put a chemical on the back of it, and if it highlights, and it'll tell them if you have cancer. If you have blood in the stool or not. If you have blood in the stool, then they look at other testing done. Like I said again, it does not always signify they have cancer. Sometimes it's hemorrhoids. Sometimes it's just colitis, which is just an inflammation of the colon, and that could be related to medication, stress, illness, things like that, a variety of things, and you just treat that symptom. Okay, but this is one of the best indicators. Okay. From there, you can do your x-rays, your mammograms, your endoscopy, your colonoscopy. So endoscopy going to the throat, colon going through your rectum, your CT scan, your lab tests. Lab tests are looking for enzymes. Again, a lot of times your lab tests are not there really to diagnose cancer, but it talks about relapse, or it tells you that further testing needs to be done because you have a cancer marker. Let's see. Increased risk for HPV. That indicates a higher risk for cervical cancer. So individuals, the physician try to look for that. Kind of read over this table 8.3, the major risk factors for cancer. So just being aware, looking at these risk factors, reading over that, risk factors and signs and symptoms. So you keep seeing smoking, so you know that's going to be a big thing. But how do you know an individual, because everybody that smokes is not going to get cancer, so how do you know these individual possibly has cancer or something is an effect from the cigarette smoking? So again, that persistent cough, constant pneumonia, again, because the immune system is wearing down. We talked about that in the previous lecture, blood in the sputum. Recognizing these changes, you guys, that's going to kind of be the main thing that I want y'all to really pay attention to. And it talks about the length of time you smoke. So been smoking over 20 years, started at 15 years. You've had exposure to other environmental smoke. So factory that you worked in, car exhaust smoke from your cars, you're constantly at risk for that. You've had a history of TB. That's dealing with your older population. You don't see that a lot now in our younger, or in this age. Breast cancer. So we've talked about those changes, but knowing that they have a family history of that. So this is why it's so important to ask these questions. Do you have a family member that has had cancer? Okay. Early menses. So for some individuals, so it kind of makes sense now why we're asking a certain question. When did you start your cycle? Because sometimes it's like, why do you need to know that? So just kind of being aware of that. And it also talks about higher education and social and economic status with that. And then alcohol. Okay. Blood in the stool. So recognizing that constipation alternating with diarrhea, it's the change. Again, you're also kind of being aware of that. Uterine, unusual bleeding or discharge, it's the change. Something that has started, the bleeding is worse than what it was before. You think about the changes with that are increased risk for HPV. Again, so you see that when you get your pap smears done. So being aware of that. Poor care during or after pregnancy. So educating your moms how to care for their body beforehand, how to care for their body afterwards, because it's these hormonal or these cellular growths that start happening. And sometimes we always think of it as being as overgrowth, but sometimes these processes take a while, and it just kind of starts. Maybe your body fights it off a little bit, and then it's just the right moment where you have this continued overgrowth. All right, smoking again. Is in it. So I'm not going to go through and read all of these, but just kind of being aware. I need you, to kind of read over, especially with skin. We've already talked integumentary. So a change in the size, the color, or the appearance of a mole, the mouth. If you start noticing any white patches, ulcers, nodules, anything like that in your mouth, okay? Prostate is another big one. So difficulty urinating, urine hesitancy, blood in the urine, or need to urinate frequently, pain in the lower back, pelvis, or upper thighs. This generally happens with you're in the age of greater than 65, African American, and then you've had a family history of prostate. So that's another one that you kind of really see. Okay, I want to point this one out. Pancreas, pancreatic cancer, there is the only ones that it says no signs. It is difficult to diagnose, And a lot of times there's no sign until the latter stages, and it is stomach pain, weight loss, and it's the treatment that they give you for the stomach pain is not really effective. They can't figure out where the stomach pain is coming from, and it's not always with smoking or other recreational drugs. Sometimes it is, but sometimes it's just that you have a lot of other chronic conditions and your pancreas is just affected. Okay. All right, table 8.4. Again, I'm not going to read all through this, but just kind of being aware, reading over this. And it talks about just when women need, or when individuals need to get tested. So again, breast cancer, so your mammograms greater than 35 or 40, 45. With that, and it kind of gives you more specifics on that. Cervical screening should begin at age 25. A lot of OBGYNs or GYNs will kind of tell you, like I said, at the age you kind of start having sexual relationships, simply because HPV can be transmitted through these sexual relationships. So just kind of being aware of that. And so it talks about that in pap smears. So it varies. And as you age, they also can tell you that you don't